So I want to discuss now a little bit about the value of patient-reported outcome measures, because they have value on many levels. By being patient-focused, by being able to demonstrate best quality care from a patient's perspective, they can identify safety issues, they can help promote this value-based care, which I'll talk about in a minute, and they can help you with benchmarking yourself and different professions against each other on how patients perceive the outcomes of our care. So we'll start with this patient-focused again. Remember, it's all about this patient-focused, evidence-informed chiropractic care. And if you are going to be patient-centered, if you want to have this approach, then obviously asking your patients what they think and monitoring how they feel they're improving over time has got to be a good thing, right? If you're using these patient-reported outcome measures, you are by definition going to be taking that patient-focused approach. And this kind of approach, this patient-centered care model, is defined as an approach to the planning, delivery, evaluation of healthcare that is grounded in a mutually beneficial partnership between healthcare providers, patients, and families. So I've taken this from this Australian PROMS report from 2018. So quite an interesting report, actually, if you want to read on what Australian healthcare providers think about PROMS and its utilisation and so on. I found it really quite interesting. So PROMS can contribute to patient-centred care in various ways. We know that. So first of all, if you take a systematic approach to assessing the outcomes of all your patients, it can provide you, the clinician, with very valuable information about the patient to guide you in your shared decision-making process. So as you're making the care plan for your patient, then you can take into account what your patient feels and thinks over time. Obviously, you need to have a good way of capturing this data. It needs to be available for you when you're actually doing this, when you're having these interventions. So ideally, an electronic system where you can very quickly and easily keep track, and you can check this out before you walk in and see your next patient. So you don't want it to be cumbersome. Keep in mind that there are some things that only the patient can know. So unless you actually ask them, you'll never be able to include this in your care plan or your care perspectives. So I think it's very, very important. Again, using standardized, validated measures. It ensures consistent information is collected from the patients, ensures that you are measuring what you want to be measuring, and it ensures that these measures don't just change for no reason. So if you are getting changes in these measures, you know that that is most likely due to what's happening in your patient's life. So obviously that's your care that you're providing, and whatever else is going on in their life would be contributing to changes. Very important. So and remember too that on all levels, these patient-reported outcome measures can provide valuable input to that quality improvement efforts. So if you want a better outcomes in your practice, then one of the key things you should be doing is making sure you're asking your patients what they think. But not only that, on a professional level and on this policy and decision-making levels, patient-reported outcomes can also help with this best quality care. So for example, if the standardized, validated, reliable PROMs are being used to assess comparative effectiveness of a whole range of different interventions, then the patient's perspective matters, right? So if patients prefer chiropractic care, along with all other objective measures of health improvements or heart rate variability or EEG or whatever it is else you're measuring, patient perspective matters. But to be able to take it into account, we need the data. So if we're not recording it, it's not going to make a difference. So again, I just highly recommend that you become part of the system that is gathering this data electronically on a large scale that the entire profession can benefit from. Another aspect from the literature we know PROMs can help with is the safety aspect. They can offer valuable input on safety improvement efforts at organisational levels and systems levels. I haven't touched on it too much here today because chiropractic care is so ridiculously safe anyway, but it's very important that we collect the data to show that we're safe, to when you then compare it with different healthcare interventions where there's a hell of a lot more side effects and nasty consequences. Again, we will come out glowingly. And I think it's so important that we do this. Even collecting the fact that, we have very little safety concerns. That's an important thing to document. Extremely important thing to document. And then there's this value-based care. And I just want to bring this to your attention because it's something that's becoming more and more thought of and discussed nowadays. And PROMs, or patient-reported outcome measures, really would help drive this value-based healthcare. What this value-based healthcare is, it's a healthcare delivery model where providers, including hospitals and doctors and everything, are paid according to patient health outcomes. So if they're paid for outcomes, not for doing things. At the moment, most healthcare systems pay for surgeries and they pay for these consultations and they pay for things that are done instead of paying for outcomes. If we move towards a value-based care, it means moving towards being paid according to what improves the health outcomes of patients the best, right? Well, think about that for a minute. What's best for a patient between chiropractic care, drugs, and surgery for low back pain? Well, like 9.9 out of 10 cases, they're better off with chiropractic care than they are with opioids or surgery. So moving towards value-based care, you would be paid because of the outcomes, which should encourage the best available evidence-based care to be taken into account, right? And PROMs would be a big part of that. Not the only part, but a huge part of that. So if patients have better outcomes, health outcomes, and they report that from chiropractic care, and they have from taking drugs and surgery, then that's what the healthcare systems and decision-making would be based on. So it proposes that these payments for healthcare services should be based on the outcomes rather than on the delivery and the volume of procedures that are done. I really like this value-based payment system, and it really would drive, like they both would drive each other. If you had patient-reported outcome measures collected in a big standardized ways, massive numbers, of course, you can very clearly see what works best for people, what patients themselves want, what works best for them, the better outcomes they get. And again, chiropractic would come out really, really well. So this is not something we should be afraid of. This is something that we should promote as much as we can. And again, I want to mention too, this whole benchmarking. It's so important. A lot of chiropractors, they don't probably even know what patient-reported outcome measures is. And so because they lack the knowledge, they don't do it and they might mistakenly perceive it as like massively time consuming, but it's not. I mean, it's a few minutes. If it's done electronically, if you've got a few simple administration systems in place, you use electronic forms as much as possible, and you're consistent with your implementation, this is a real easy thing to do. I know from the research literature we need to educate the profession on it, which is obviously why we've got a class on this, but I highly, highly recommend that you use patient-reported outcome measures in your practice. It is simple, it is easy to track, it's great for the patient to know that you care enough to ask them what they feel and think under your care about what matters to them. It's okay for you to have some specific questionnaires you want to ask everybody, but also let it be a little bit up to your patient, depending on what it is that they've come to see you for, you have some specific patient-reported outcome measures for that as well. Hence this introductory class, so you've got an idea of what that could be. So I'm going to finish off just talking a little bit about a couple of organisations that do this larger data collection for us, and I want to encourage your participation with that. But before we do, just pause and test yourself on what we've covered so far.